Levy. I'm a psychiatrist in private practice in Columbus. And I've been very active in the OPPA in a variety of capacities. Right now I'm chair of the Public Information Committee. I've also served on the Private Practice Committee and in other capacities. There are a lot of really wonderful things that I think the OPPA does and a lot of ways to become involved with OPPA. One of the most important things that happens in my committee, Public Information, is the opportunity to disseminate information to the public through the press. We contact the media or respond to media requests for information to make sure that mental health issues are appropriately dealt with, that they have a psychiatric perspective, and that adequate information, accurate scientific information, is being disseminated to the public. The important things that happen in the OPPA is not just the dissemination of information through the Public Information Committee, but dissemination of information to psychiatrists. OPPA does that through the annual meeting, which is wonderfully attended. They also do that through emails and newsletters, giving information to psychiatrists about what's happening in the state, what's happening in the legislature, things that are important to know as a psychiatrist in terms of getting adequate information to know how to practice, know how our practice is changing, how we can facilitate better patient care. So in addition to scientific information that comes to us through the annual meeting, there are a variety of novel pieces of information that come to us through the OPPA that help us to become better psychiatrists, better informed psychiatrists, and provide better patient care. Among the other things that I think are important that OPPA does is to serve in an advocacy capacity. Now, clearly OPPA does an important job advocating for psychiatrists and advocating for our profession. They do so in the legislature, they do so in the public, they do so in the media, they do so among other physician groups. And so the liaisons that are formed through OPPA help to get our message out and make sure that psychiatry continues to be practiced in the most effective and most efficient ways. We're also an advocacy group for our patients. And this is a really important thing that OPPA does that there are really no other avenues to achieve. Patients really have a very difficult time advocating for themselves. Psychiatrists singularly have a difficult time advocating for our patients in the media or with the legislature. But the OPPA can do that for our patients, making sure that they get the care they need, making sure that we're able to provide the kind of treatment and services to them that are going to facilitate their recovery. And I think that the advocacy both for our profession and for our patients are very important and necessary roles that OPPA play.
Climbing up on South